There are a lot of things that I think we can do. One of the first things is really to start thinking a little bit about how much time the patient spends at the hospital. So often we have processes that patients have to follow in terms of coming ahead of time. So, are there ways that we can help to streamline things? So we've tried to streamline by looking at ensuring that we match patients from the very beginning. So we provide RH and K matched blood cells. So we do that at our institution. And what we try to do is to help prevent them from making antibodies so it doesn't slow the process down. Once they have antibodies, it takes us a lot of time to find blood for them. They need to come in a couple of days ahead of time to get everything ready so that we can have the appropriate blood for them. So that's one of the things to think about. I think the other issue is just sort of really answering the question, what are the right transfusion thresholds for patients? Should we be transfusing them at higher thresholds, or should we be using lower thresholds? And so I think we really need to spend a lot more time with some research in terms of figuring out what is the best transfusion strategy for each of these patients. And it's probably not all the same across all patients. So I think we've got a lot of work to do in terms of optimizing transfusion care for patients with MDS. So what's exciting and coming up in terms of transfusion support for MDS is that we are finally seeing some of the early feasibility trials come out, one from the UK and one from Canada as well, looking at what should be the appropriate transfusion threshold for patients. Both of these studies looked at patients transfused with a restrictive threshold, so usually to maintain the hemoglobin between 85 and 100, versus a liberal transfusion threshold, so maintaining the hemoglobin between 110 and 120. And basically trying to see whether or not there was any difference in quality of life, so which is quite important in patients who are on chronic transfusion and need to come back and forth. And we want to make sure that they're actually experiencing an improvement with transfusion. And so both of these studies did not show that there was definitely an increase in the number of units that patients received. Potentially a slight signal towards an improved quality of life in those patients in liberal transfusion arms, but it was not clear across. And I think one of the disadvantages were in the Canadian study, we did see that there were increasing ferritin, so higher indicators for iron overload. So I think there's still lots of questions to be answered here, and I think we need sort of bigger studies with longer follow-up to get an idea of what we should optimally be doing for transfusion in these patients.